Have you ever felt burning or throbbing pain in your joints? It usually happens in the morning or after you've been sitting or not moving for a little bit. Well, it could be arthritis or the inflammation of one or more of your joints. On today's program, we'll talk about the causes, the types, and the treatment for arthritis. I'm Dr. Freddy Gomez. Welcome to MedTalk Health Talk, your connection to healthcare. The risk of arthritis increases with age. It can't always be prevented, but there are healthy habits you can practice to reduce your risk of developing arthritis. With us today is Dr. Geraldine Zamora, an adult rheumatologist and a consultant at the St. Luke's Medical Center. And we also have Dr. Christine Bernal. She's a pediatric rheumatologist and a consultant at the Asian Hospital and Medical Center. Thank you both for joining us. Now, Dr. Zamora, before anything else, let's explain to our viewers what happens to a person with arthritis.
First, I'd like to explain what arthritis is. It's actually a joint condition wherein there could be damage in the cartilage or there could be inflammation of the lining. Not all joint pain is arthritis. It could just be soft tissue rheumatism. So this is important for our viewers to understand. Arthritis can also be caused by many conditions. There's not just one type of arthritis.
Yeah, that's true. Now, the symptoms of arthritis usually develop over time, but sometimes they can also appear suddenly. Now, still with Dr. Zamora, what are the symptoms that our viewers should know with regards to arthritis?
Ang osteoarthritis, or OA for short, affects the lining of the joints or the cartilages. Supposedly, our joints have these cartilages para po smooth, no, yung galaw, smooth yung surfaces wherein the joints slide against each other. So in osteoarthritis, there could be degeneration or parang nauupod na po yung cartilage surrounding the joint. And this can cause symptoms such as pain. Because in osteoarthritis, hindi lang po yung cartilage yung may problem. There could also be a problem in the surrounding tissues, including the ligaments, tendons, and other parts of a joint. So in fact, it's what we call a joint failure. No? Hindi lang siya painful because of one damaged area.
Okay, now there are over 100 different types of arthritis, but two of the most common include osteoarthritis, which Dr. Zamora touched on earlier, and rheumatoid arthritis. Dr. Bernal, what's the difference between osteoarthritis and rheumatoid arthritis?
Osteoarthritis is a degenerative form of joint disease and often seen in the elderly, but children can get osteoarthritis, but quite rare. And this is usually due to trauma, so trauma-related, or some genetic mutations that somehow affect the cartilage. So these kids can have early onset osteoarthritis. While rheumatoid arthritis is more of an inflammatory type of joint disease, so these can be seen both in adults and children.
Arthritis is common in adults over the age of 65. Now, Dr. Zamora, aside from age, what are other risk factors for arthritis? Both, if you can talk both about rheumatoid and osteoarthritis.
Okay, Doc Freddy, for the first type, which is osteoarthritis, which you mentioned that is more common as we age, another risk factor is being overweight or obese. And if somebody has previous trauma, for example, you were an athlete when you were younger and you've had previous joint injury, then this is something that can lead to earlier degeneration of the joint, resulting to osteoarthritis. So this is most commonly in the elderly population, but because of the previously mentioned risk factors, it can also happen in younger people. On the other hand, rheumatoid arthritis is an autoimmune inflammatory arthritis. So it's in an entirely different category. It's usually seen in females, but males can also be affected. Usually, this affects women in the reproductive age, and it's polygenic, meaning it can be inherited. It doesn't mean, though, that if somebody in your family has rheumatoid arthritis, then everybody else would have that. But since it has genetic predispositions, for example, somebody in your family has one autoimmune condition like rheumatoid arthritis, it's not impossible for somebody else in your family to have another autoimmune condition, such as that, or even lupus, or even other kinds of autoimmune diseases.
Okay, so that's good that you clarified that. Now, we also mentioned that people of all ages, including children, can develop it. Dr. Binal, let's discuss what is juvenile arthritis?
So, juvenile idiopathic arthritis is the rheumatoid arthritis in children. So, this is, as mentioned by Dr. Jing, this is an autoimmune inflammatory disease that affects children less than 16 years of age. So, typically, these children would complain of pain, swelling, stiffness in the joints, and then if you check their range of motion, it is somehow affected as well. So, if the arthritis would persist for 6 weeks or more in at least one joint, in a child who's less than 16 years of age, and we have ruled out other causes, then we can make the diagnosis of juvenile idiopathic arthritis in children.
Now, Dr. Bernal, how can arthritis affect a person's quality of life?
Well, definitely a child who is in a lot of pain, wakes up in the morning very stiff, would definitely affect their normal daily activities, especially for children who has significant swelling in the joints. That would definitely affect the range of motion. So they would have difficulty like opening the doors, even writing, dressing up on their own. So it can definitely affect their normal daily activities. It depends on the severity of the joint inflammation.
Another common and complex form of arthritis is gout. The pain that comes with it is sudden and severe. Let's talk about it when we return. You're watching Med Talk Health Talk on CNN Philippines. I'm Dr. Freddy Gomez, and you're watching Med Talk Health Talk on CNN Philippines. Now, a lot of us have heard of the term gout, and anyone who has it will tell you how painful it can be. This type of arthritis affects more than 1.6 million Filipinos, and repeated bouts of gout can lead to gouty arthritis. Dr. Zamora, what happens when you have gout? At ano ang mga pangkaraniwang causes nito?
So, Doc Freddy, you're right. Gout is really one of the most painful kinds of arthritis. What happens in gout? Uric acid in your blood crystallizes and deposits, no? Pumupunta siya sa mga kasukasuan, therefore leading to a very robust inflammation. So, sa gout, yung inflammation or swelling could be sudden, and it's usually sudden, very fast onset, and maximum pain and swelling within 24 hours.
Now, research shows that nearly half of gout cases affect the big toes, while other cases affect the fingers, the wrists, knees, and heels. Now, Dr. Zamora, what should our viewers do in case they do feel those symptoms?
Okay, so gout attacks usually happen very quickly. So it's said that the maximum swelling and pain will occur within 24 hours. So sudden, usually yan yun parang pagising nila, napakasakit na. You're right in that 50% of people may experience this in their big toe or on their big toe, but any joint can be affected. Usually though, it happens on the joints in the lower extremity. So sa ankle, tuhod, big toe, but it can also happen in other joints of the body, especially later on, pag mas matagal na yung gout, and once this is more uncontrolled or mas mataas yung uric acid level in the body. So there's pain, swelling, difficulty in movement, And yun nga yung sinasabi ng patients namin, mahipan lang daw ng hangin. It's already very, very painful, excruciatingly painful. So first aid, what can they do? It's of course, it's very important for people to consult because not all gout attacks are just gout attacks. Sometimes there could be infection also inside the joint. But first aid, they can apply ice packs and try to rest the joint first, and then call your doctor. Try to get a schedule for consult.
And while arthritis is more common in women, gout primarily affects men because they produce more uric acid. So let me go back to what causes gout and the high levels of uric acid that form and accumulate in and around a joint. There are foods that are high in uric acid. So ang ibig bang sabihin nito, we need to avoid these totally?
You're right, Doc Freddy. There is actually more to gout control. In fact, a lot of people beat themselves up trying to avoid all kinds of food. No, bawal daw lahat. Bawal ang beans, bawal ang munggo, bawal lahat. So it's really important for us to try to avoid food high in purine, which leads to uric acid inside the body. And these are alcoholic drinks, red meat, even potatoes, no? But more importantly, sugar and salt. So yun kasi yung parang hindi naman natin naiisip na possibly contributory to uric acid accumulation. But more importantly for gout control, since gout can be genetic, it means yung production of our uric acid is also genetically predetermined. Mas important in the long run for many of our patients to be on these maintenance medicines that will lower their uric acid in the blood. Because even if you remove all the uric acid containing food in your diet, we still produce uric acid on a daily basis. It's a waste product. So habang buhay tayo, we will produce uric acid. So that's why a lot of our patients will need maintenance medications to lower the production of uric acid or to increase the excretion o yung paglabas nito sa katawan.
Diet is only part of how gout can be managed or controlled. Lifestyle changes and medication as well as a visit to your doctor are important as well. Meron bang risk ang mga bata para makuha ang gout, maapektuhan ng gout?
Well, gout is very rare in children. Well, it can happen in a small subset of patients. And these are the patients who may have a genetic mutation that affects the uric acid. So these kids would have elevated uric acid levels and then eventually can develop gout.
Now, as with many diseases, early detection and diagnosis is key. Dr. Zamora, how can you detect gout?
Very easy to diagnose. First, we check your uric acid level, but it's also important to remember that it's best to check uric acid when you don't have a gout attack because, for example, you get peripheral blood. Di ba dito usually kumukuha ng dugo? And then you have a gout attack. Usually, the uric acid in your blood is already in your knees or wherever it is that is having this joint swelling. So we get the uric acid level, ideally when there is no attack, and we correlate it with the symptoms of the patient. As mentioned, yun nga, usually sudden, severe joint swelling and pain. And the characteristic of this usually is that the pain can disappear at the outset, initially, in the first few years of gout. Even if we don't treat it, you don't do anything about it, it can disappear on its own. And you will have pain-free intervals. Minsan nga years, no, ang wala kang joint swelling. So diagnosis would need high uric acid. Sometimes we will ask for an X-ray or even an ultrasound just to check if there is already deposition of uric acid crystals there. But basically, it's clinical presentation plus high uric acid level. And it's also very easy to treat. So hopefully we will not have patients who will have damaged kidneys just because they did not act early on at hindi natin naibaba yung uric acid nila habang hindi pa komplikado yung illness.
That's right. And when we return, we'll talk more about prevention, management, and treatment of arthritis. Keep it right here on Med Talk Health Talk on CNN Philippines. I'm Dr. Freddy Gomez, and we want to be your partner for a lifetime of good health. It's good to have you on the program today. Now, while there is no cure for arthritis, there are ways we can prevent it and manage it. Getting yourself checked is a vital step. Dr. Bernal, if someone suspects symptoms of arthritis and decided to see a doctor, what can they expect during the checkup?
In the first visit with the doctor, the first thing that we always do is to get a history. It is always important to know the onset of the symptoms and the duration and all the other associated symptoms, because it is very important for us to know where the arthritis is coming from. And of course, after that would be to do a complete physical examination, particularly checking on the presence of inflammation in the joints. And then after that, if we need to do certain tests, then we will do that for us to be able to know exactly the cause of the arthritis.
Now, Dr. Zamora, what are the commonly used medications naman for arthritis?
Oh, Doc Freddy, that is kind of difficult because there are over 100 types of arthritis. So the medications or treatment will depend on what type of arthritis a person has. For example, for osteoarthritis, which is the most common arthritis that affects mankind, it's more common among the elderly. Usually, we give pain relievers. But there are so many kinds of pain relievers as well. We have to tailor it to what the patient has. For example, the patient already has predisposition to kidney problems, or already has damaged kidneys. We have to avoid certain medications. For example, naman, the patient has a liver issue, then we shy away from medicines that can further aggravate the condition. Bottom line is, we have to know what your arthritis is, so that we will give you the appropriate treatment.
That's right. So there are a lot of medications made for to control those different forms of arthritis. But still with Dr. Zamora, when is surgery naman an option?
What we advise the patient when the joint is already damaged beyond what we can control medically. So for surgery, we refer our patients to our orthopedic counterparts, our orthopedic surgeons. Sometimes, for example, in osteoarthritis and rheumatoid arthritis, the joints are already damaged and it's causing the patient severe pain, or sobra na siyang sakang or pikit, that it hinders effective walking, or it hinders daily activities. For example, some of our patients also have damaged hands, no, from different kinds of arthritis. So we refer to our orthopedic surgeon colleagues.
Okay, now healthy habits work across the board. And with arthritis, these practices can make a difference. Dr. Bernal, what are some of these best practices in order to control the pain from arthritis?
Particularly for juvenile idiopathic arthritis, I would always advise my patients to have a healthy, balanced lifestyle, okay? In terms of diet, there's really no specific food that would prevent arthritis in juvenile idiopathic arthritis. And sleep early, particularly for kids, at least sleep 8 hours a day, drink plenty of water, and no stress, because stress, infections, these are the common triggers for arthritis.
Now, it's good to know what is in your diet that can trigger certain types of arthritis, or it can trigger gout. But there are certain types of fish which are rich in omega-3 fatty acids, which is a healthy polyunsaturated fat, which can reduce inflammation in the body. And with that, we'd like to thank our guests for today, rheumatologist Dr. Geraldine Zamora and Dr. Christine Bernal. I'm Dr. Freddy Gomez. On MedTalk Health Talk, we bring you the knowledge and care you need, especially in this time of COVID-19. We'll see you again next time. Stay safe and be well.